An empty road, empty houses. We're driving into the new stronghold of the virus, and to one village at its heart. In Kigbal, a cluster of children on one side of the road. We soon discover why. On the other side, everyone is either dead or dying.
The BBC's Andrew Harding on the ground in Sierra Leone, where just 5 months ago there were under 500 reported cases of Ebola. As we continue now on America's Forum, we should note that the World Health Organization says that as of February 25th, there are now 11,300 confirmed cases of Ebola in Sierra Leone. They have caused almost 3,500 deaths. Overall, 20,000 cases of Ebola and over 9,000 fatalities worldwide. Those numbers multiplying significantly, yet it's just about disappeared from the news. We will talk more about that as we turn to our medical policy expert, Betsy McCaughey, who Skypes in from New York. Betsy, obviously this is disturbing news about Ebola, but very quickly, let's begin with Obamacare, as tomorrow the case again will appear in front of the Supreme Court. And I could not help but note your column today in the New York Post with the headline, "We all win if Supremes gut Obamacare." Please explain.
Well, the reason I wrote that column is that there are so many ghoulish predictions out there made by Obamacare supporters that if the court rules against the Obama administration, people will lose their insurance, their medical care, even possibly their lives. Don't be bamboozled by these predictions of disaster. The three important things to know is that the truly poor who are on Medicaid will not be affected by this decision. 9 out of 10 people who have gained coverage for the first time because of Obamacare are on Medicaid, and they have nothing to worry about from this decision. Secondly, people who have enrolled in the Obamacare plans and may lose their subsidies if the Supreme Court rules against the administration will be helped. The Republicans in Congress have already made a commitment to providing temporary assistance to those people until they can find other policies they can afford. So that's very, very important. And thirdly, people in 2/3 of the states will suddenly be relieved from the pressure of having to pay penalties if they don't have insurance, and their employers will feel free to hire people full-time instead of part-time and to hire more people without worrying about going over the 50 limit.
Well, Betsy, let me go back to one of the principal charges being made in the press. There have been reports that of the 10 million receiving Obamacare, 5 million will lose their insurance, and this could shut the market down. How do you respond to that talking point that's appeared in the press?
The only big loser is the insurance companies. They are predicted to rake in over $1 trillion of our money, taxpayer money, over the next decade, providing these subsidies. So they are inundating the Supreme Court with arguments to protect their cozy deal. But the fact is, everyone else is going to be taken care of.
All right, so we've got that intact, and of course we will be watching the Supreme Court as that case is heard tomorrow. Now, let us switch gears and talk about Ebola. According to the World Health Organization, the week of February 22nd, 99 new cases of the disease, 63 of them in Sierra Leone, and it turns out the vice president of that nation has quarantined himself following the death of one of his security guards from Ebola.
Well, that's a very smart thing, because a virus of this nature knows no class or government position. Anybody can get it. And although it's tragic, it's totally predictable that this disease is continuing to spread in some areas. Although the United States government and other governments have poured money and facilities and manpower into that region, it's hard to stop it overnight. We see tremendous progress in Liberia, but in Sierra Leone, it's still getting hit hard.
And mindful of this recurrence, or so it seems to so many of us in Sierra Leone, Betsy, do you think the public health measures that the U.S. and the World Health and WHO have been involved in Will they bear fruit? Will we see the numbers go down again, or is it just problematic there?
Well, the most important undertakings have been to confine the disease. I am still concerned about the lack of a more rigorous barrier to prevent people who may have been exposed to this disease from traveling to other continents. We don't want this disease to spread elsewhere, and we've seen isolated cases, as you know, in Europe and one in the United States. But other than that, yes, many of the precautions that have been taken, providing facilities for the sick, training more medical workers, there was a severe shortage of them, are bearing fruit.
And mindful of that, let's bring it back here to our country. Ebola in the news with that survivor, Nina Pham, filing a lawsuit yesterday against the hospital where she was treated and where she worked as a nurse, claiming the staff was not properly trained, they didn't have the proper protective gear to handle the disease. She went on to say she's doing this for better working conditions for all nurses. Is this the best way to achieve that? We have about a minute 45 left.
That with the call, you know, some of the big nursing organizations from the beginning were very outspoken against being exposed to Ebola without the proper protective gear. And the real culprit here is the CDC, which misled hospitals into believing that their routine infection prevention precautions were sufficient. Those precautions aren't even sufficient to stop the spread of MRSA, VRE, C. diff, infections that are killing over 75,000 Americans every year in hospitals. Clearly, those precautions are also inadequate to stop the spread of Ebola. But I'm not sure that Nina's lawsuit will be successful because hospitals are judged based on standard of care. And there was virtually no standard of care for Ebola in the United States. We hadn't had a case.
If she is successful with this lawsuit, will it have a chilling effect on public health in the United States? About 30 seconds.
No, it won't. There are many lawsuits against hospitals now based on acquiring infections in hospitals.
Fair enough. Betsy McCaughey, as always, we appreciate the insights and the analysis you offer. Thanks for setting the record straight on Obamacare as that case moves to the Supreme Court tomorrow. Thanks also for your assessment of the recurrence or the climb in cases of Ebola there in Sierra Leone and what is happening in terms of courtroom maneuverings and lawsuits here in the United States. We will call upon you again in the not-too-distant future. And when we come back, thank you, ma'am. Bennett Kelly coming up following this Newsmax Now update.